So CAR T-cell therapy has some toxicities. So namely, cytokine release syndrome and neurotoxicity, or ICANS. And so the EASIX score is an endothelial dysfunction score that's been validated in allogeneic stem cell transplant and predicts actually for complications from stem cell transplant. So we're trying now to kind of look at this score, okay, in patients who receive CAR T and see if this score can actually predict, CRS and ICANS. The score was tested in lymphoma, in CAR T-cell therapy for lymphoma and ALL, so acute lymphoblastic leukemia, and actually it was found that it can actually predict CRS and ICANS. So we wanted to look at that in myeloma, patients who receive actually CAR T-cell therapy, and see if the EASIX score actually can predict CRS and ICANS. So we looked at a cohort of, I think, 200 patients, and the score was actually, we were able to show that the score can predict CRS and ICANS in myeloma patients receiving CAR T-cell therapy as well, not just lymphoma and ALL. This is really important because we're trying to figure out what the risk factors for CRS and ICANS are, and this score can help us with that. Now, something else that we looked at was a novel score that we came up with in our patient cohort that can actually predict ICANS. This score actually incorporates EASIX, and then along with the patient's EGOT performance status and their cytogenic abnormalities. So patients with a high risk score on EASIX and a higher performance status and a high risk cytogenetics. So patients with all three of those risk factors are the ones that actually have the highest risk of getting ICANS after CAR T-cell therapy. So this is really important because you can actually predict, if your patient will have side effects from their CAR T-cell therapy, and this could serve as, the basis for prospective studies in the future, looking at prophylactic treatments for prevention of, CRS and ICANS.